I am going to have my clock in front of me so that I don't lose track of time. Well, thank you so much to those of you who have joined. Welcome to the BP Harmony Mental Health webinar. My name is Imran Ghani. I'm the founder of Bipolar Harmony, and with me are my colleagues, family nurse practitioner Nazia Iftikhar and Dr. Umar Aryan, MD, who is a physician in hospitals, and I'll tell you a little bit more about them once we get started with the presentation. So the agenda for our 2-hour presentation today will be covering what we at BP Harmony called 5 pillars of bipolar disorder recovery. Then, to substantiate these 5 pillars, we will have Nazia talk about integrative medicine and the place of a more holistic approach to mental health in the bipolar disorder recovery journey. And then finally, because a lot of people who come to BP Harmony come when there's a state of crisis, um, we also felt that for this free webinar, we want to create a resource, not just live, but in the future to be posted in public for people to know what to do when someone is having their first manic episode and no one knows what's going on. And so there are certain protocols that Dr. Omar from the emergency medicine side will give us some tips, some strategies, some protocols to have in the case of an emergency, both on the manic side as well as the severe depressive side. And in between, I'll be intersplicing the BP Harmony touch of including some practical breath work, some movement of the body, because when, in my own recovery journey, and I'll tell you a bit more about my story in the next slide, um, uh, just, diving into theory is good for the person trying to understand what is bipolar disorder and um, what is it that we're in for? But then going ahead, because the symptoms are so severe, uh, often people who come to BP Harmony are looking for some form of immediate reprieve, whether that be through advice on medication, breath work, yoga, nutrition, how to get good sleep. And so I'm giving you a little insight into the 5 pillars. So before I go into these 5 pillars, I want to introduce myself formally and give you the origin story behind Bipolar Harmony. In the fall of 2019, um, I think someone is knocking or I'm trying to enter, so great. Looks like everything is working. Welcome into whomever just joined. We are just getting started, and I'm giving you the origin story of Bipolar Harmony. So, in the fall of 2019, I was doing my master's in religion at the Harvard Divinity School. And I had just finished my master's program in Berkeley. I was working full time. I was traveling a lot for work. And something in me was burning like more and more energy, more and more excitement. And then I rode on this high of success, of getting into my dream school, crushing it at work, finishing my coursework in my previous master's program with honors distinction. I started doing retreat, uh, relief work in Pakistan. I started a supplements business. I was doing a lot. And there came a point where I wasn't sleeping at all, maybe 1 to 2 hours. And then at some point, I became a little bit delusional. I was vacillating between happiness, sadness, anger. I was feeling highly energetic, and people around me were starting to see grave signs of imbalance. I resisted such critique and said, you know, you all don't know what I'm going through. I started then to believe that while I was at Harvard, that some sort of grand shift was going to occur in the world and that I had some significant role to play in it. So then the level of delusion came to a point where I started seeing meaning where normally we don't see meaning. I started seeing meaning in colors. I started, you know, projecting meaning onto numbers. I started feeling grave feelings of paranoia. And there were some very erratic purchasing decisions that I made that I still remember. I spent around $600 in books at the bookstore where it didn't register to me that I had access to perhaps the biggest library in the world. But that's what happens when someone does not know that they are in a manic state. And because I was in the religious sciences, I thought I was having some kind of religious experience. And for that reason, I thought, well, no one understands what I'm going through. But then, nonetheless, I decided to reach out to a mentor. And my mentor said, well, it is possible that I'm having an experience. I'm showing grave signs of imbalance. And for that reason, I should go see a psychiatrist. So reluctantly, I went to go see a psychiatrist, and in about 5 minutes of showing my rapid speech, my interrupting, my uh, irascibility, my impatience, I was diagnosed with bipolar disorder. Now, when I was diagnosed, I resisted it, but there came a point where I could not deny it any further. I saw that I had done quite created quite a mess in my personal life, and I accepted the protocol of the psychiatrist to put me on four separate medications: antipsychotics, mood stabilizers, and even in my particular case, some painkillers because of the level of pain that my body went under. When being put on these medications, I was knocked into a haze where I didn't know the difference between my wakeful haze and my nightmarish dreams. And 3 to 4 weeks later, I find myself back in my parents' home. I have taken a sabbatical from my master's program, and ultimately I had to drop the program. I woke up from that haze 3 to 4 weeks later, having been so heavily medicated because that time it was an emergency, and the most important thing was to stabilize me. I found myself in Houston at the doorstep of mania's dark sibling, depression. For me, depression felt like brain fog, spending hours in bed, not having the will to get out of bed, to cut my nails, to groom myself, to take a shower. I had a terrible migraine. I had constipation, really bad constipation because of the effects of one of the antipsychotics, terrible anxiety. And then, of course, those of you that may be watching who either have bipolar disorder or who know someone with bipolar disorder, I just could not sleep. I couldn't fall asleep. I couldn't stay asleep. I couldn't go into the deep, rejuvenating cycles of sleep. And when I woke up, I just felt like I didn't get any sleep at all. So most of 2020, which was the year of COVID, a pretty generally a stressful time for everyone on the planet, I was going through the marshy waters of depression. And these four symptoms of insomnia, constipation, um, migraine headaches, and anxiety led to the very, very dark and unpleasant feeling of suicidal ideation. And it took a lot of will to realize that it wasn't that I wanted to end my life. I just wanted the misery to end because it was quite intense for a period of 13 months. The worst thing about this whole, this whole predicament that I found myself in, I was grieving the loss of my academic career. I didn't know if I could go back, was the message that I would receive was that I had a lifelong mental illness and that I had to be on medication for the rest of my life. At the time, I was aged 30, and that felt like a death sentence to me. It felt like a life sentence of, well, are you telling me that this is what the rest of my life is going to look like and that I have to take these mind-numbing medications and do therapy here and there and maybe go do exercise? Is there something out there? And so we fast forward to the fall of 2022, 3 years after my initial diagnosis, and after poking around on the internet, finding voices of people who live with the illness, finding resources like BP Hope, finding these voices of people that have not only recovered, but they've healed themselves and completely tapered off of medication. I tapered off of my final medication. And to the surprise of my psychiatrist, asked me, well, how did you do it? What did you do? And I said, well, I experimented with nutrition and I worked separately with a nutritionist. I went to a gym and I worked separately with an exercise coach. I went to the yoga studio and learned how to meditate to quiet the chaos of my mind. And I even have a teacher certification now. And I realized that I needed to prioritize sleep. So I exhausted my body by gardening a lot and walking outside. And then I realized also community was a big part of it, that I had my family, but I also plugged myself into wellness communities like yoga studios or rock climbing gyms where everyone has their own story. And so I was able to plug in my story with a community of people that were having some kind of shared experience. And what I realized in that story is a lot of people in the modern world are dealing with some form of chronic health issue. And at the root of it is an imbalance in lifestyle, an imbalance in sleep, an imbalance in relationships, an imbalance in food, and an imbalance in the sedentary lifestyle that we have. And so my response was, well, I have these five pillars that really help me. And well, long story short, I won't belabor the point. That is the origin story of the five pillars of bipolar disorder recovery at BP Harmony. I sat down and I said, you know what? Let me sit down and write something down that I could have benefited from when I was first diagnosed in 2019. And if someone had laid this out for me, sleep, nutrition, movement, mindfulness, and community, I would have felt a sense of hope that there is the possibility of recovery, that recovery is possible. And when I mean recovery, that is something that we define for ourselves. Some people are comfortable staying on medication, but people like myself wanted to come off of medication completely. Once you define what recovery looks like for you, know that it is always possible to achieve, to reclaim your life again, to reclaim your career, to reclaim your relationships, to reclaim that taste of life that you once had. And we're going to get into these five pillars. And what I realized coming from the experience of having bipolar disorder and coming to a stage now where I haven't had to take medication for over 2 years now. And in the same way that I haven't had to take an inhaler because I had asthma growing up as a kid, I haven't had to take an inhaler for over 20 years. My hope is, and my belief, because it is now substantiated by science, by medical professionals who have joined the BP Harmony team, that these five pillars are going to help me not only survive, but thrive in my remaining days. And I felt compelled that now that I have this knowledge to get out there, to share this story with people that might be a sense of loss. Sleep is the foundational pillar of bipolar disorder recovery. All of the other pillars don't matter if we're not getting quality sleep. My recommendation to anyone who is watching is set an 8 hour fixed sleep schedule. Go to bed exactly at the same time and get out of bed exactly at the same time. It will train your body to fall into a certain rhythm. Next is nutrition, to eat a high quality whole foods diet. Eliminate processed foods, eliminate caffeine, eliminate alcohol, eliminate cigarettes, marijuana, movement. The idea is to move the body to still the mind. And one thing that I will offer is because the challenge of being in a state where we're really sensitive, some form of exercises can tip us over into hypomanic or manic states. And so I say do movement that is low in intensity, but long in hours. So things like yoga, things like walking, things like gardening, mindfulness. With mindfulness, we ask, what is the mind full of? One of the most salient experiences of having bipolar disorder is uncontrolled racing thoughts. And those racing thoughts often become negative loops of, um, traumatic sometimes memories that play over and over and over again. And once they fester in the mind, then they begin to manifest physically on the body, tension in the body, pain in the head, tightness in the jaw, and then mood swings when someone is in such a negative state. And finally, a community, a community where, like, I found I couldn't really, during the COVID era where we couldn't go outside, it was very difficult to find online communities because they were so overwhelmed by people looking for support. And there was nothing kind of specifically geared towards bipolar disorder. Bipolar disorder kind of gets lumped in with OCD and depression and all of these others. And I would sit in with folks who were going through it, but sometimes it was hard to relate because, well, bipolar disorder, while it might have many similarities with other mental illnesses, there are some salient features that I didn't feel I could talk to. So all of these five pillars, if there is one thing that you take away from what is it that BP Harmony does, it's these five pillars. And now you might be asking, well, this seems a lot. This seems like an overwhelming amount of things. And where do I begin when it comes to eating right and exercising right? That's where bpharmony.com comes into play. It's a resource, there's a blog, there's tons of free resources that's out there. My intention in starting this was to create a resource that is something that I could have benefited from in the future. So, without further ado, I like to just practice from the beginning and start right away. We're going to get into the theory, and that's why I've invited two physicians to the webinar today that are going to talk about the disciplines of medicine that take a more holistic approach to mental illness and chronic health issues at large. That is the discipline of integrative medicine, as well as emergency protocols that don't necessarily numb someone to, a zombie-like state that I was numbed into. And I want to say that all of these things that we're saying is given in the spirit not of uh, saying don't go to conventional psychiatrist. It is that we are people who have gone through the psychiatric system, who have gone through the modern mental health system and realize that there's a lot of opportunity for improvement, that there is a lot of opportunity for a more integrative approach to chronic health issues. So let's go ahead and do some mindfulness breath work. I'm going to move back a little bit so everyone can see my chair. Obaid, can you confirm whether or not people can see my belly, placing my hand on my belly, or should I lower the camera a little bit lower?
Yeah, if you can lower it just slightly. We can see it, but uh it's like cutting off. Oh, yeah, that's perfect.
Okay, thanks, Obaid. Obaid with U-Turn Productions. He's my right hand guy. Thanks a lot, Obaid. Appreciate you. So one of the things that breath work does is it is one of the things that brings our awareness from here. That's all in the mind, thinking about the ruminating thoughts that keep occurring. And when we bring our awareness to the breath, we will notice that the awareness from here will get distributed throughout the body. And that's what it is that we mean when we say we are moving our body to still to still the mind. And so for those of you that who are joining the webinar, I invite you to participate and see how this may affect your mental well-being. We're going to place our right hand on our belly. We're going to plant our sits bone into the chair. We're going to straighten our spine, and we're going to relieve the tension on the neck, relieving the tension and imagining that the head is afloat on water. When we inhale with the nostril, we will inflate our belly like a balloon. And when we exhale, we will exhale with our mouth and deflate the belly like it is a balloon. So I'll demonstrate deep inhale and exhale with the mouth. So let's go ahead and do that for a couple of rounds and see how we feel. Place your hand on your belly, sit up tall, relieve tension on the neck. Imagine that the head is afloat on water. Deep inhale, inflate, and exhale, deflate. Deep inhale, and exhale. Deep inhale, and exhale. A lot of our tension, because we're breathing with our chest, will occur because we aren't breathing with our belly. Deep inhale, and exhale. In the next inhale, let's notice the quality of the air entering in our nostrils by asking questions like, is the air cold or hot? Is it moist or is it dry? What kind of smells are there? And we notice the mundane details of the air coming into our lungs. Deep inhale and exhale. Deep inhale and exhale. Deep inhale and exhale. Wonderful. The next breathing exercise that we're going to do is called box breathing. Now, box breathing is something you will find all over the internet, and it is a great way when feeling anxiety. It is a great way to help deepen the breath and then to also relax our nervous system. So one of the things that we've talked about ruminating thoughts, spiraling negative thoughts, one way to break that cycle is breath work. And so imagine a box, and we're going to start at the top of a box, and we're going to inhale, hold, exhale, hold. And the trick or the goal is in the beginning when we are tense and we're panting almost, we might be only able to inhale for 1 second, hold for 1 second, exhale for 1 second, and hold for 1 second. But the idea is to prolong the breathing. All four sides remain equal, but we inhale for 3 seconds, exhale for, hold for 3 seconds, exhale for 3 seconds, hold for 3 seconds. And we can elongate this to 5 second inhales, 7 second inhales, but we might realize that we're breathing very quick and short breaths. But when we breathe deeply, diaphragmatically, and we learn how to control the breath, it's a fantastic way to learn to control the mind. So we can close our eyes and imagine a box. Visualize a box. You may decorate it with whatever features that bring you joy, that bring you happiness. For example, mine is a white colored box, but it's glowing. Um, and I like the fluorescence of my box. So I'll start at the top, one corner of my box, and I'll take a deep inhale, hold, exhale, hold. So those were 1 second, but we'll do 3 seconds now. So let's begin. 3 second inhale, 3 second hold, 3 second exhale. Slowly release the air, and 3 second hold. Deep inhale, hold for 3 seconds. Exhale, slow release for 3 seconds. And hold for 3 seconds. Deep inhale, 1, 2, 3. Hold, 1, 2, 3. Exhale, slow release, 1, 2, 3. And hold, 1, 2, 3. Last round. Deep inhale, 1, 2, 3. Hold, 1, 2, 3. Exhale, slow release, 1, 2, 3. And hold, 1, 2, 3. Great job. That one is a little bit more technical, but nonetheless, once we get the hang of it, it is a fantastic way to relieve the symptoms of anxiety and spiraling thoughts. The last one, which has become popularized, is the double inhale technique. This is a fantastic way if you find yourself in the market, at work, unable to control that overwhelming feeling of anxiety, the tightness of the chest, the dryness of the mouth, the lump on the throat, the tension behind the neck, to take a deep inhale and then another inhale and to hold for 7 seconds and then to exhale. Just need to do that maybe 3 times, and it is a fantastic way, not just for people with bipolar disorder, but for anyone who might be feeling anxious. It is an amazing way to go ahead and experience immediate relief. And don't worry, we're going to get into all of the science of how this stuff works when Dr. Umar is going to present. So let's go ahead and straighten our spine once more and take a deep inhale. Another inhale. Hold for 7 seconds. 1, 2, 3, 4, 5, 6, 7, and slow release. Exhale. Deep inhale. Another inhale. And hold. 1, 2, 3, 4, 5, 6, 7. And exhale. It might feel good when you take that deep inhale with the belly. You might feel that stretch of the diaphragm. Feels fantastic. One more last inhale. Another inhale. And hold. 1, 2, 3, 4, 5, 6, 7. And exhale. Slow release. Ask yourself, how is your body feeling now compared to when before we started breathing? For example, I feel that my blood is pumping a little bit more vigorously. I feel some heat in my body, and I also feel a little bit more relaxed than I was before the beginning of this breathing. I hope you find some benefit in this and see the merits of breath work in the mental illness recovery journey. Now let's do a little bit of desk yoga. Yoga often in the West is viewed as having to wear the right clothing, to have a yoga mat, to be in a studio. But a lot of stuff we can do right here, just sitting on our desk. And for many of us who might have sedentary jobs, this is a fantastic way to relieve tension in the body after being sedentary for so long. So I'm going to move my webcam again. And Obaid, can you confirm again if everyone you can kind of just see my torso um, and my arms and my head. Or if maybe Obaid stepped away, Omer or Nazia, can you all confirm if you can see me?
Yeah.
Yes.
Yes, sorry.
Perfect, no worries.
It was on mute, but yeah, we could see it.
Okay, awesome, awesome. All right, so we'll go ahead and bring our hands together, and we're feeling this sense of warmth. We're feeling a sense of vigor after doing some breath work, and we will take a deep inhale, raise our hands up, and exhale, bring our hands back down. This is designed to straighten the spine and to relieve the tension of the shoulders and neck. Deep inhale and exhale. Deep inhale. And aspire to bring your bicep muscles next to your ears. Like sometimes we'll bring it here, but you'll really feel the stretch when you bring the bicep in between your ears. And exhale. Next inhale, we're going to keep our arms up. Deep inhale. And from here, I'm going to exhale, reach high with my right arm. Reach high with my left arm. Reach high with my right arm. Reach high with my left arm. In the Chinese medicine discipline, and go ahead and continue reaching with both arms side one after the other. In the Chinese medicine tradition, the flow of qi or energy, what modern medicine may call the nervous system, this for the Chinese medicine physician is designed to help clean the energy of the liver and of the spleen. In future, I will definitely be talking to Chinese medicine physicians and bringing them on to webinars to talk about how these practices help alleviate some of the severe symptoms of mental illness. So deep inhale, reach up, reach up, reach up with both arms. And exhale, we'll make cactus arms, sending our elbows back, puffing our chest forward, imagining that we're trying to grab a pencil with our shoulder blades. And we'll invert our cactus arms and feel the blood rush down to our fingers and relax. So you might be feeling a little bit of burn on the shoulders. That's okay. They're saying thank you. Thank you for activating us. Thank you for relieving some of that tension. Now what I'd invite you to do is to cross your fingers and to extend them towards the screen, and imagine that your shoulders, you are popping them out of the shoulder socket by sending them forward, and then you're popping them back in by sending them back. Forward, back. Forward, back. Forward, and back. I'm going to place my fingers behind my neck. I'm going to open my wings and close. Open my wings and close. Open my wings and close. Next, what I'm going to do, it's going to be pretty involved, but it's a really fun one. And if people ask you what you're doing at work, just let them know I'm looking to find out what my mind is full of by moving my body to still my mind. So I'm going to take my right ankle and I'm going to place it onto my left thigh. All right. Can y'all see my foot, or do I need to move further back?
We can see your foot.
Awesome. So I'm going to take my left hand and I'm going to place it onto my right knee. So my left hand, I'm going to place it onto my right knee, and I'm going to drop my left shoulder onto as close as possible that I can get to my left ankle. And it seems I'm pretty tight today, but I'm just going to let gravity do the work of opening up my hip flexor, my abdominal muscles on the side, and I'm going to touch my right shoulder with my right fingers. I'm going to look up, reach up, look down, inhale, look up, look down, inhale, look up, and from here, I'm going to come back into the center. And now we'll do the same thing on the other side, where I'm going to place my left ankle onto the right knee. I'm going to take my right hand this time, place it onto my left knee, and then I'm going to lean my right shoulder onto close as possible to my left ankle. Oh yeah, I'm nice and tight this morning. But over time, usually with a 1 hour to 90-minute yoga practice, my body will open up and a lot of the tension that I'm feeling will dissipate. So I'm going to place my left shoulder on my left fingers to my left shoulder. I'm going to look up, reach up, look down, inhale up, exhale down, inhale up, and exhale down. And we'll come back to the center. I'm going to check the time. And that concludes our applied 5 pillars, where I invited you to look at the pillars of movement and mindfulness by observing the breath. So we're a little bit ahead of schedule, but that's okay. We will continue on. What I can do right now is maybe see if the people who are attending the workshop, if you have a question of the things that we've covered so far, feel free to send it on the chat or to come off of mute and ask your question. I think Zoom has a feature where you can raise your hand as well. Any questions in the chat? Because I can't see it right now. All right, seems like there aren't any questions. So we'll go ahead and segue over to the next section of our webinar, discussing integrative medicine and bipolar disorder. So going back to my original story of when I was first diagnosed with bipolar disorder, I found that there was an overemphasis or an over-reliance on pharmaceutical drugs. While they certainly have a place in the care of someone who is in a manic episode or severe depression, there is a lot that can be done to not just supplement, but to act as a core part of the recovery process for someone diagnosed with bipolar disorder. And it took me some time to stumble upon a discipline that is established and up and coming in America. And I'm really excited to introduce Nazia, who is in the field of integrative medicine herself. So without further ado, I want to introduce you to Nazia Iftikhar. Nazia Iftikhar, she is a family nurse practitioner with over 13 years of experience working in urgent care facilities. So she's dealt with mental health crises. And then she also, with her brand of back to school healthcare, as well as back to healthcare, where she offers her own services through telemedicine services and also through BP Harmony. Um, this is how with BP Harmony, I have physicians that you can consult and work through insurance. And you know, she went through the conventional medical training, but she found that she was quite thorough in her approach. And that's where she decided to also pursue a fellowship in integrative medicine, focusing on psychiatry. And we've been in the podcasting room the last 2 weeks, and I've benefited so much from this conversation. But one thing I appreciate about her more and more is when she says that integrative medicine is something that looks at multiple modalities of treatment and recovery and doesn't jettison conventional medicine. It still applies the use of medication, but there are so many things in the world of supplementation and other therapies that are now evidence backed. And that is the key feature of integrative medicine, is that any sort of alternative approach, whether it be yoga, breath work, acupuncture, it is something that is only taken seriously in integrative medicine once it is evidence backed through clinical trial. But I don't want to misspeak. I'll let Nazia take over. And please, Nazia, feel free to come on to turn your camera on and your microphone, and I'll let you take it from here.
Hello, Obaid, can you confirm that you can see me and hear me?
I can see and hear you.
Perfect. So I am so excited about being here. But first of all, I wanted to give a shout out to Imran. You know, public speaking is definitely not my strength, but he instilled this confidence in me. And gosh, I've never had such intense breath work and stretching beforehand. And now I feel rejuvenated. Some of that tension is gone. And I can't wait to incorporate some more of the yoga and the mindfulness that Imran gives us. And so now I feel stoked and I feel like I have more energy to talk about a topic that is very near and dear to me. So, as Imran said, I am a family nurse practitioner and I have been practicing for about 13 years. I primarily work with pediatrics, although I am trained to see all ages. I first saw myself in the urgent care setting, pediatric urgent care, and then I fell upon the school-based setting, which was really neat because I got to be the on-site healthcare provider for the kids that went to that school, which meant that I got to know these families really well. I would see them walking down the hall. I would watch these kids grow up. And I felt a certain level of ownership and responsibility to do right by them. And I also found that because, with the permission of the families, because I was able to see the patients more frequently, I got to follow up closer with them. And I also got to experience some of the frustrations that some of the patients had and some of the families had because of gaps in healthcare. I would see frequent flyers to the school nurse's office because I shared my clinic space with the school nurse. And that was how our model was set up. And I would see children who would frequently see the school nurse, something as generic as stomach pain. And then she would refer them to see me, and I would do an initial history taking and consult. I would rule out the primary causes of illness, such as constipation or reflux. And then there was a period of time where we were kind of in limbo. And I would continue seeing these kids, going back to see the school nurse frequently, and we would wonder, is this anxiety? We would do our proper referrals to see a GI doctor, but as you know, the wait list can be long. And at the same time, I would witness these children going through what they are going through with their health concerns. And I would want to do more by them. And so what ended up happening is I would investigate further. I would do a few more tests. I would, consult with my supervising physician. I would find that with her consult, I would come up with more guidance on which direction to go, and a more extensive plan. I would find myself ordering more tests than are typical. And I would find myself wanting to have a team. And I would find myself advocating for the families. With the family's permission, I would talk to the school nurse and the school team to ensure that their healthcare needs and their plans were met at the school. And because of that, I would also find solutions. I would see some of these kids get better, and it was so personally satisfying for me to do that. And at the same time, I also got the hint that perhaps the setting I was in was not necessarily conducive to that level of thoroughness. And I had mixed feedback where I would have some people say, "Hey, Nazia, you're good job for being thorough and finding the diagnosis." And then I would have others say, "Maybe you're a bit too thorough." And that's when I was at a crossing point. I had to figure out what kind of healthcare provider I want to be. Do I want to be more streamlined, or do I enjoy finding a solution for families? And that is when I decided to join the field of integrative medicine. And when I first looked into the field, my mind was blown because when I went to my first conference in my fellowship in integrative psychiatry, I saw like minded folk. And it was so validating for me because there were these healthcare providers who were just as thorough, if not more than I. And I did not have to start from the ground up. I could learn from their experiences. And I felt, you know, kind of, I don't know if any of you all are gamers, but I felt like, first I was Mario and then I became Super Mario. And it was just so exciting for me to help my families and fill a gap in a way that I wasn't able to before. And that is why I decided to focus on integrative psychiatry as my initial fellowship training. And that is when I came across Imran, and we had like minded ideas about how to integrate and help our population. And that is how we started working together. So, next slide, Imran. So, what is integrative medicine, you might ask? Well, to sum it up, it is the application of conventional medicine and complementary medicine in an evidence-based way. So, according to the Consortium of Academic Health Centers for Integrative Medicine and Health, integrative medicine is defined as the practice of medicine that reaffirms the importance of the relationship between the practitioner and the patient. It focuses on the whole person, it is supported by evidence, and it utilizes all appropriate therapeutic and lifestyle approaches. And it utilizes disciplines and healthcare professionals to achieve optimal health and wellness. So that was the part that really appealed to me, is that I come from the conventional medicine model. I went to school, I went to nurse practitioner school, and I feel like integrative medicine is an add-on, where it's not like I'm giving up my conventional medicine model. I am enhancing it, by incorporating things. And I love the fact that this allowed me to have a shared decision-making model with my patients. And often with patients with chronic disease, they find themselves advocating for themselves and say, hey, surely there must be more that we can do for our health. And that is where an integrative provider would echo that and find solutions with them. And we always want to provide effective interventions that are natural and less invasive, while also providing conventional treatment when it comes to medication. If my patient needs medication, they get drugs, but I get to help them find other modalities and integrate it and mesh them together. And that is the exciting part. Next slide. So I am sure in your own training, in your own search, just like Imran mentioned, his search for finding solutions, that you have come across a lot of different names and different labels. And I myself, when I've started looking into integrative medicine and functional medicine, I was like, wait, what's the difference? What are we talking about? I remember before I was introduced to this concept, when a patient would come in and see me and they would say, hey, what about ashwagandha? What about this? What about that? What about acupuncture? I wouldn't necessarily have the experience or the expertise to say anything about that, where I found myself saying things like, um, hey, that's great. If that helps, if that works for you, great. But I would not have anything more to say about it. And also, when they would ask me about supplements or taking anything in addition, I would, emphasize the importance of a balanced and healthy diet. But I would not have enough training to actually answer those questions. And I felt like there was a gap there. And I'm not saying that the conventional medicine model has gaps, but I just feel like the training for integrative medicine for evidence-based practices has been lagging. Integrative medicine is a new model. And so I get to come back and learn that now, where I didn't necessarily have the extensive training before. So back to semantics, complementary medicine. You've heard that phrase, and that just means you are using an approach where you are using complementary medicine in addition to conventional medicine. And then you've heard of alternative medicine. That is a non-mainstream approach and used in place of conventional medicine. So as a patient, you may say, I don't want to see a doctor, a physician, nurse practitioner, or PA anymore. I just want to see somebody who is in an alternative medicine realm. That would be alternative medicine. And complementary is when you mesh them together. You might ask, well, what's the difference between complementary and integrative? Integrative is really cool because not only do you bring them together, but it is in a coordinated way. What does that mean? That means that, if you go back to Imran's experience, where he found those 5 pillars that he found fundamental, you will find later on in these slides that he was not the only one incorporating those concepts together. And as an integrative healthcare provider, the onus is no longer on my patient to find those alternative treatments on their own, or the patient does not have to feel that they need to not disclose that or feel like they have to do it on their own. They get to talk to somebody trained in integrative medicine where they get to not only bring it up, but the provider has enough knowledge where they can guide them properly when it comes to dosages, when it comes to how it relates to the medications they're already on, and make them more empowered. And also, it's an avenue for where, with the patient's permission, I can set up a network where I can communicate with the alternative medicine providers, such as Imran, and develop a more cohesive, comprehensive plan. I find it amazing and remarkable that he was able to do this on his own for the most part with some guidance, but with an integrative provider, you get to have that one-on-one and feel that there is an ownership there between you and the provider where you can come up with a plan together. And that is the exciting part of integrative medicine. And then there's functional medicine. And functional medicine is interesting. It is a systems-based biology approach that focuses on identifying the root cause of illness. So what is the difference, you might ask? Some of the licensing is a little bit different, but also some of the ways of an approach is a little bit different. Functional medicine providers look at root cause of illness and come up with very, very extensive plans. And integrative medicine focuses on meshing that with conventional medicine. And while functional medicine providers also come from the conventional medicine model, which is great, there's just a little bit of subtle difference in how they practice the integration. And I myself, I'm still a baby in this field. I'm still completing my training. I would love to go back and also look at the functional medicine model and also incorporate the both so that I can provide a more holistic wellness approach for my patients. Next slide. So let's talk about where integrative medicine comes in for bipolar disorder. Well, bipolar disorder, as you know, is something that is chronic. And as I mentioned before, those with chronic conditions are often looking for long-term effective solutions. So for these patients, integrative medicine is an attractive option. And especially for patients with bipolar disorder, in order to have a more balanced long-term treatment plan. So depending on the client, the medication may be a necessary component or may simply not be enough for their treatment plan, where they are looking for more. And that is where integrative medicine comes in. Also, it's a balanced treatment. It would incorporate conventional along with complementary therapies. The provider, once again, would have knowledge of how these therapies may interact and guide you very carefully on things like tapering and things on mixing, because even natural supplements have side effects. And so what happens is you get the best of both worlds. And then the cool thing, once again, is the burden would no longer be on the patient to try different therapies and supplements on their own. And they would have a well-informed physician or healthcare provider to guide them. Finally, it's already a known fact that integrative and complementary and alternative treatment is already in use. It is actually quite high for the usage of complementary treatment in the bipolar community. It is not a novel concept. In fact, it is estimated that up to half of individuals diagnosed with the mood disorder use one or more complementary therapies. So it's already there. It's just that now you get to have an extra level of well-informed information so that you can incorporate this complementary therapy in a more empowered and safe way. Next slide. So you might ask, how would my visit look? Well, just like, when you see your conventional psychiatrist, there's going to be an intake interview. Your integrative provider might gather pertinent information about the patient's medical, psychiatric, social, family, religious, and spiritual history. The history taking, though, will likely be a bit more extensive and thorough. And in a later slide, I will show you a diagram of what exactly I mean. And the assessment, well, the conventional medicine model is based on your biopsychosocial model, right? So this is the typical model that is used in medical training and is an overarching framework of psychiatry. And it looks at the biological, psychological, and social factors. And the integrative psychiatrist may look at causes and meanings of the symptoms and in a more robust way, and may involve more robust and sophisticated testing. One thing you will find in common in both is thyroid testing is one of the tests that will probably be done pretty early on. And the reason being is because those with bipolar disorder are more than twice as likely to have thyroid dysfunction. So that's definitely a test to investigate what may be provoking the symptoms. Other examples are genetic testing to look at causes of the presentation and also see what that patient individually may be sensitive to when it comes to medications and how they affect the body and how their body affects the medication. And they might do an EEG test, which is to measure brain electrical activity. And they might do functional tests, such as stool analysis, urinary assays, salivary assessments, maybe tests for inflammation and immunological factors, maybe an extensive test for gut health, and an assessment of vitamin deficiency. And then they come across the part of the treatment, which is the recommendations, the treatment goals. And those are clarified at this stage. And then this is the key, that the recommendations are reviewed very carefully. And what do I mean by that? Well, if a patient discloses anything that warrants an urgent concern, for example, suicidal ideation or psychosis that may point to a medical emergency, they will be immediately referred to a hospital emergency room. And that is where Dr. Arian and his talk will be an important piece to talk about how that would look. But when the review of systems does not point to an acute emergency, then the patient may choose to work with, primarily a conventional psychiatrist or an integrative medicine provider or both to take ownership and find a cohesive solution. The practitioner at this point should inform the patient of clinical findings and impressions, and the key is that is within his or her expertise only. Because there are certain integrative providers who have specialties. For example, there may be one who knows more about mold exposures, another one who is an expert in gut health. So it's about taking ownership about what we know and finding the resources for what we don't know so that our patient gets the best, safest, and more enmeshed and empowered care that they need. And then they develop a treatment plan that includes a review of benefits, potential risks of treatment, and informed consent would be documented, and a return appointment would be scheduled depending on factors like the severity of symptoms. If your symptoms are a bit more severe, your provider might want to see you sooner. If you are somebody who is gravitating towards wanting to wean off some medicines, or you're worried about some side effects that you've already been having, then they might see you even more sooner than otherwise. So that's the general idea. Next slide, please. So this, I hope you can see it, but if not, we'll find a way to share it with you. But I myself am doing my fellowship from the Integrative Psychiatry Institute. And what really led me to sign on for this fellowship is this treatment map that I saw early on. And this was provided by the Integrative Psychiatry Institute, and I'm still at the learning stage. But as you can see, there are multiple modalities that are considered. Whether it's checking your gut health, to detox paths, to optimum nutrition. As you can see, no stone is left unturned in investigating all the different modalities. However, it's really cool that one concept that I kept coming across in my training was the idea of incorporating dialectical behavioral therapy, cognitive behavioral therapy, and meditative practices and techniques such as what BP Harmony offers, which is the yoga. And if you look at this map, it is not too far off from what Imran saw in his own experiential experience and how he dealt with all the different steps. And that is the cool part, is that I get to work with him to develop treatment plans if that is what the patient wants. And we can guide in a more cohesive way. And I thought it was really cool that there's a man in the middle and he's doing yoga. Next slide. So you might find that your provider may recommend certain supplements if they are an integrative provider as an add-on, an adjunct to your treatment plan. Remember, these will be incorporated on a case-by-case basis. And because there are so many different factors that have to be considered, and side effects, and you have to be very careful about how you taper and how you add on nutraceuticals and supplements. But this is just to give you an idea of some of the supplements that could be added on to your treatment. As you can see, there's magnesium listed here, there's folate, there's omega, there's N-acetylcysteine. And this is just to give you a light introduction on where your provider might lead you, very carefully. And once again, my disclaimer is that you should always be guided by a healthcare provider, and the information I'm giving you today is to empower you to find the type of healthcare provider that can do this with you carefully. And they will weigh all the risks and benefits. For example, the incorporation of magnesium may help reduce the dosing of mood stabilizers. The table above was cited from Dr. James Lake's article of a review of evidence and recommendations published in the Psychiatric Times. And I just find it, what I find neat is that it's a customized treatment plan that can be incorporated based on the phases your patient might be in. And once again, close monitoring by a trained healthcare professional is key. Next slide. And so I truly believe what this quote says. My hope for the future is that integrative medicine will be taught to all health care professionals, and payment incentives will be revised, hopefully, to support its practice. I truly believe that this is a meshing of both worlds. It's just that the research is not as robust, and we need lots more robust studies to guide us towards this enmeshment, because the outcome would be a healthier patient when we combine all the different modalities in a careful, evidence-based way. Imran, do you think you might want to transition to Dr. Arian, or do you want to stop for
Sure.
some? What would you
Sure.
like to know?
Yeah, we'll transition over to Dr. Arian, and we'll have questions and answers. If you have those who are attending, if you have questions, you may send them in the chat. But we will also have time for question and answers at the end of the presentation. Go ahead, Nazia.
I can go ahead and transition, and then you can take over from there. But one mention that I had earlier was that as part of our assessment as integrative providers, we always make sure that the patient is not in a crisis mode, such as suicidal ideation or psychosis. And it is our responsibility at that time to guide our patients to the proper emergency room setting so that they can be evaluated further. And that is why I'm so excited that Dr. Arian is part of our webinar to talk a little bit more about what that looks like.
Thank you, Nazia. First of all, I wanted to reflect and say that I still am in a bit of like disbelief that I could have worked with physicians that would have been supportive of my desire to be off of medication and to experiment with nutrition and yoga and breath work. And I, it's really nice to hear from you that the integrative medicine discipline and this rising field in the medical field, which, like Nazia said, that there are integrative medicine psychiatrists, integrative medicine cardiologists, integrative medicine obesity specialists. And, I did work with integrative uh, psychiatrists. And what I found is that they're very thoughtful in their approach, spend a lot more time talking to you before giving you a diagnosis and medication. And so I agree with you that just instead of having had to do this on my own and trial or an error and hearing something here and seeing if it works, just having a medical expert on my side throughout the process, um, would have been great. And it wasn't that I didn't have those supporters, because I did have someone like Dr. Arian by my side. Um, but he brought, the conventional medical model and then what he found in the medical research when it came to yoga, but something that he is continuing to work on. Then the second thing that's inspiring to me is this idea that all of medicine is moving towards a more integrative approach. I think a general sentiment in the modern world and in the West specifically is this overprescribing of medication and the desire to move towards foods that are healing, lifestyles that are healing, as opposed to being things that we're perpetually having to take medication for, which comes with its horrible side effects and long-term effects on other organs, which then creates more medication and more prescribing, and then the doom cycle of debt and insurance and all of that stuff. So definitely I see the benefit and a real cavalier work that integrative medicine physicians are doing in getting people to do lifestyle changes, more holistic approach, as opposed to being, taking just the pharmaceuticals, which they have their place, but they can also have detriments. And then finally, I know that you love talking about supplements like magnesium, and we just did a podcast interview, which you can find at bpharmony.com in the community section. So check it out. But I want to transition over and make sure we have sufficient time to talk about mental health crisis management. So Dr. Muhammad Omar Arian is a physician in Washington. He has bachelor's degrees in psychology, biochemistry, religion, and then he has a master's in healthcare, and now he's completed his residency and is a intensive care unit physician who, God bless him, has a desire to do more fellowships and more expertise in emergency medicine. So he's a lifelong student and a good friend of mine that provided me a lot of care when I was going through my mental health recovery. And you know, Nazia's portion is after someone has stabilized and who is going through kind of figuring out, how do I get out of this cycle of perpetual medication and symptom management. But prior to that, typically when someone is first diagnosed with bipolar disorder, it's because something extreme is happening, either a manic episode or a depressive episode, and that there needs to be certain emergency protocols in place in order to prevent harm to self and harm to others. So I'm going to hand it over to Dr. Omar. Omar, you can come off mute and you can turn your webcam on and take it from there.
All right. Good morning, everybody. Thank you for that introduction. Yeah, as Imran mentioned, I've been with him through this journey, and my initial interest started in psychology, which is what I first started majoring in, and has always remained a core interest of mine. But as you mentioned, I'm an intensive care hospitalist, so I primarily work in the ICU, but I also work on the other medical floors as well. So I primarily deal with people when they've hit crisis mode in their medical problems and psychiatric problems. I don't work in a inpatient psychiatric facility, but my role is pretty much stabilize those who come in so they can get to the next step. And run next slide. So first I want to talk about is, what's been referenced to is you're having a crisis, you go to the ER. And this, the ER experience, if you've had experience already with it, then you're kind of familiar with it, but there's always this, oh, I don't want to go to the ER, because it can be overwhelming. It's a hustle and bustle, taking care of other critical patients going on. Everyone that's coming into the ER is taken care of, and the patient is the focus, but it can seem sometimes like a chaotic, but I can promise you that it's a organized chaos. And so the goal for somebody coming to the ER, why do you come to the ER first, is to rule out medical causes. And on the slide later, I'm going to show you some, but the ultimate goal is to get to the mental health specialist, but first you have to rule out some medical issues. You need to make sure they're stable before they can go to that next step. Otherwise, any interaction they have with a mental health specialist would not be beneficial. So important points when you're in the ER is, it may be taking time to see, it may seem like that, but your nurse that's assigned to you is assigned to you and is watching you the entire time that you're in the ER and escalating to the providers, as symptoms become more pressing and more concerning. And typically in these situations, you're coming by ambulance, and so they might already know some detail. But the point I make is whether you or your loved one is the one that's in the emergency room, that you do your part and tell your part of the story and your context, because things are sometimes just abbreviated, and we actually need time to talk to the person and talk to the loved one. So if you're coming in and you're not the patient, but you're a loved one, then it's important to stay and provide your context, because it does help. But the overall goal is determine the safest possible discharge plan, depending on the nature and the ability of the person to commit to a plan. Next slide. So what is a crisis? Crisis is pretty much defined as a progression of thoughts or behavior that culminates in something, actions that can be a danger to themselves or danger to other people, or inhibiting basic level of function. They're not eating, not drinking, not doing what we need to do to stay alive. Those would be considered a crisis. And anything can trigger this, but the idea that it is a perceived setback that the person cannot overcome. There can be something financial, something health-wise, somebody else's health, and unfortunately, there's even something reading in the news can be a trigger itself. Next slide. And so these are some of the symptoms that can start off when you're having a crisis or starting to have a crisis. And you'll see that some of these symptoms are very remarkably similar to a person having a heart attack, person having signs of an infection, person having stomach problems, some sort of urgent, symptom from that point of view. Sometimes people can even have blood in their stool. So these are all things that kind of suggest a medical problem, and it's important for those things to be ruled out. But more often than not, psychiatric symptoms can also occur in isolation without any of these symptoms, just more changing behavior, anxiety, fear, the feeling of doom. Next slide. But the idea is that these symptoms, if they're not treated early on, they kind of progress into these severe symptoms. So extreme depression, extreme sadness, extremely tearful, anything seems to, trigger detachment, withdrawal, and psychosis, as Nadia mentioned, as well as suicidal and homicidal intent are, of course, the main concerns. Next slide. And so these are, I mentioned psychiatric symptoms can occur in isolation, but even when they're in isolation, they can still be due to a medical reason. Brain tumor, drug use, Cushing syndrome, thyroid issues, as Nadia mentioned, cardiac conditions such as the heart, beating irregularly, can cause some of these symptoms because they trigger a response in our body, and it kind of translates to our brain, and our brain is telling us we need to react, and so they start expressing psychiatric symptoms as a result of something medical. So that is the main reason, the main importance of doing the medical screening. Next slide. And so what is the intervention? Once you ruled out the the medical causes, it's a collaborative effort from the person, from the loved ones, from the responders to the nurses, the clinicians. All the idea is to determine the next step. Everybody helps, everybody is part of the story, and everybody contributes to the assessment and the plan. And how we gather information and do things is some of the things that I'm going to cover in the next slides. But as a side note, what I want to mention here is if anybody is having a crisis, and especially the suicidal, homicidal ideation, there is a suicide crisis lifeline. And this number I have on the screen is the one in Texas. But depending on where you live, you should look up that number, especially if you or your loved one have a mental health disorder. It is important to know this number and save it in your phone and memorize it. Some states don't have a simple 3-digit number. Some of them are longer, so sometimes you have to save it. But these can be, push come to shove situation. These can be a lifeline for you. Next slide. So the models that I talk about that that clinicians use when we're approaching somebody with a health, mental health crisis are varied. There's a few models out there, and just depending on how you train and where you train, you can learn several of them, and then people just kind of take a inclination to one of them. And one for me is the ABC model. And it's kind of there on the screen is to mentioning the A for active listening. And that's kind of the first step is where they're doing most of the talking. You kind of, if you need to ask a question, it's an open-ended question and it's as few words as possible. The idea is that the individual that's having the crisis explains most of the situation. And then when they start feeling, like, oh, they're running out of things to say and they're just kind of looking towards you. And if it's not already been identified at this point, what is the trigger? Then you start asking a little bit more emotional, more open-ended question to find out what is the emotional response. How did that lead to the cognitive response? What did they start thinking because of those emotions? And how did that lead to the action? What was the actual action, or what were they planning to do? And then the final C, create a plan, is how are we going to deal with this problem? And that is not something that's just decided on the clinician point of view. It's decided, again, as I mentioned, from a collaborative effort from everybody, especially the patient themselves. Next slide. But what's the relevance of that for if you're not a clinician, you're not trained? There is some emerging evidence that a simplified model of this ABC model can be used by anybody, even responders, people on the scene. And the main key difference is that the first step is to assess for immediate danger, because I mentioned you're on the scene. So things can not always safe from the get-go. If the person that's in a crisis is swimming in the pool, right, you want to get them to a safe place. If they're hiking or climbing, mountain climbing, something like that, you want to get them out of that dangerous activity first and put them into a situation where it's safe for them to continue to talk. And on the other, on the flip side as well, if there's homicidal intent, like they're brandishing a knife, then you need to get yourself to safety first. And I know the first thought is, no, I need to help the person. But if you yourself are in danger and you're in threat and you're still in an environment where they can be a danger to you, you actually can't help them yet, because you haven't removed the trigger from their environment. They still have an action that they can do. But if you take away that dangerous action, then you can actually start talking to them. So it is important to make sure that they're assessing for immediate danger to yourself and to the person themselves. Once that's done, then you can just be present. Encourage grounding technique if you guys are, in the same BP Harmony group, or you're in some sort of therapy together, and grounding techniques that you work on each other. Remind them, hey, let's do that boxing exercise, and box breathing, where you kind of do the 4 breath in, the 4 breath out. Let's do that together. Or even if you're not in the same group, it's doing something. Let's take a deep breath and something from there. To try to help them be calm. But again, the idea is not necessarily to get them to do whatever you want to do, it's just to be present. And then if that working, if being present seems to be working, they seem to be connecting to you, they're talking to you, they're having a conversation, then it's the same thing that I mentioned in the last one. Your part in the role is just keep the questions open-ended and try to get help if somebody else is not already doing it. Is ask them, is there someone I call? Can I call your loved one? Can I call your mother? Can I call emergency services? What can I do to help you out? The next slide. And as I mentioned, it's kind of assessing danger is also kind of assessing yourself. And also, what if you're the person that's having a crisis? You can't really apply the ABC model to yourself. But there's a technique that I teach to the families, especially in the emergency room and in the hospital, that the situation is stressful, not only for the person themselves, but the people around them. And there's certain things that you have to regulate your own emotion before you can be helpful to the person themselves. And the stop technique is something that I use and I teach. I don't always, call it stop technique. Sometimes I just go through the steps with them. But it's basically a mindfulness-based stress reduction principle that there's been, and I'll refer to the studies later, there's been a lot of studies that these are very helpful in de-escalating situations. Next slide. So what is the stop technique? The stop first is literally the S stands for stop. Stop whatever you're doing. That pause that conversation, pull over to the side of the road, step away from the group. Sometimes visualizing a stop sign is extremely helpful for people, especially in US where the stop sign is, everywhere. The goal in this step is just to shift yourself from reacting to reflecting. Like, okay, let me not react to whatever the trigger was, and let me just reflect and think about what's going on. And then the next step is T, take a breath, but this can be any grounding technique, including the box breathing that Imran went over earlier. But the idea is to calm the nervous system and reduce the feeling of panic. And I'll talk about the physiology behind this a little bit later. And the O stands for observing thoughts. This is identifying your emotion and labeling them. This is one of the few situations where labeling actually works. It is one of the times that you want to label it so you can understand that it's okay to feel this way and what you're feeling. And then start thinking about what action were you going to do in regards to this trigger. And that kind of goes to the last step of proceed with intention. Are you at a point where I can respond to this? Was it a question? Was it an act of aggression? Do I need to remove myself from the situation? Do I need to go take a walk? Or do I need to continue work on grounding? Or no, I'm in a spot where I can respond. I thought about it and I have my emotions and I will react thoughtfully rather than impulsively. Next slide. Now, I want to make a point here that these are things that we're going over the slides, and it's to give you some insight. And the idea is that you don't have to be extensively trained to use these techniques, but you do still require some training because real life practice is what makes makes these situations more applicable when you're actually having a crisis. So practicing these scenarios when you're actually in calm and not in a stressful situation, so that it becomes muscle memory when it is an emergent situation. That's where the practice is needed, and this is something that you can do through programs like BP Harmony and do with your therapist to kind of make these stuff second memory. Next slide. Now talk about all this, and even in the emergency room and in the intensive care unit, our goal is always, you shouldn't even get to this point. There's preventative strategies for everybody, and that applies to healthcare. Preventative medicine is the backbone of all fields of medicine. And so the first thing I talk about, especially for mental health, is be honest with yourself. The phrase "I'm fine" is not fine. It's a knee-jerk reaction, and it's not necessarily the person that's asking you needs to know all the detail. But I find that often that people say "I'm fine" and they actually believe it for themselves. They don't think about that response. But I would encourage you to take a step back. That even if you don't need to tell the person who's asking, but think for yourself: do I feel nervous? Do I feel loss of interest? Do I feel like I'm losing sleep? I'm eating less. I'm having headaches all the time. These are, even if they're transient, can be symptoms of some underlying mental health issue. And at least be honest to yourself, because that's the first step to getting better. And if you do decide to proceed with getting help, then you have to be able to honestly say what you're feeling to that. Regular for mindfulness and coping skill practice. These are, and personal crisis planning, things that can develop through programs like BP Harmony. And through these programs like that, you can also build a community. And a community is, essential to any medical problems and psychiatric problems. When you're amongst like-minded people, it can help tremendously to help you get through these situations. Next slide. So the last thing I want to point out is evidence. Everything we do is evidence-based medicine, as Nadia mentioned, and ideally these are basically randomized control trials where you have a control group and you have the group where you're doing the intervention on. But you can't always do that. I mean, sometimes it's a relatively new problem. There's not a lot of evidence. or just unethical. Having one group where you do chest compressions and another group where you don't, that just wouldn't be ethical at all. So we can't really do a randomized control trial in that setting. And so in those situations, we rely more on case studies where, somebody publishes, oh, this was a patient I was taking care of with the permission of the patient, and this is what happened. So it's just one individual, or retrospective studies where we're looking back and seeing things that already were done, and it's kind of separated into the group, but those things are not controlled. And so there are some limitations to the study, but the field of mental health is no exception to that rule with the limitation of randomized control trial. So some of the studies I go over, the first one is a systemic review published from the Frontiers in Human Neuroscience in 2020. And this was talking about all these mindfulness techniques. Why do they work? What is the visual evidence that we're seeing behind that? And Nadia mentioned some stuff like EEGs, where they kind of put electrodes around your brain to read your brain waves, and functional MRIs, basically, where you go into the scanner and you can see certain parts of your brain light up. And we know what those functions are. Know what part of those brain, what they do. And they notice that with these breathing exercises that it activates your parasympathetic response, and all these mindfulness techniques and exercises like yoga. And that's why it works, because it kind of stimulates that rest response. And then talking more about just mindfulness technique itself without any these functional MRI, there's a trial called the PREVENT trial, where 424 patients from 95 general practice were compared with mindfulness versus just antidepressants. And they found that mindfulness can be just as effective as antidepressants in preventing relapse of depressive behaviors or recurrence. And then the studies for crisis planning and building community, there's a couple of studies out of Cambridge in BJ Psych and also psychological medicine, which showed when you have this community, have this crisis planning, you can have a 25% reduction in compulsory admission, basically showing up to the ER with mental health crisis. Next slide. So what is that? Putting it all together. There's this study that was published in 2022 in the effects of yoga, particularly hatha yoga, in bipolar depression, and what does it do to relieve some of the symptoms of depression and other symptoms from bipolar disorder. And it showed some effectiveness. It said that it could be effective, but more trials are needed. But when you combine this study with the other studies that I mentioned, with the breathing exercises and mindfulness techniques, all these techniques that are done through yoga just by its very nature, there's a good amount of evidence that these programs can be used to help people wean off of medication, or even prevent the need for medication in the first place if it's instituted early enough. Make a point, it's not a substitute. It is something to work with your team, and your provider can be a key role to that. And something I want to comment more on what Nadia mentioned as well is, sometimes that first interaction that you have with somebody is not good. It kind of detracts you away from it. It's like, this physician didn't help me, didn't get me through it. But I would also argue, that it's pretty much like any other service industry. Your first experience with your provider might not be the one that was good for you, but it is, to make it work, you need to find that team, find that therapist that work for you. And so I would encourage you to look and shop around for people, and groups like Deeply Harmony can help you do that. So with that, I'll hand it back to Imran.
Thank you, Dr. Arian. I appreciate a lot of the things that are here, practical tools, because from my blog, I'll get emails from folks saying, I have this one person in my life and we go to the ER and it's just so traumatic and so difficult and I don't really know what to do. So this knowledge for me, when I was going through it, was cathartic in and of itself. People who are putting things on YouTube, and we will put this recording on YouTube once it's edited. But just putting this knowledge out there, the studies are being done, more and more evidence is coming up, the protocols are there. And I think it helps you as a physician to work with people who come to the ER who have some level of training. And speaking of training, this is one thing that Dr. Arian and I are going to record in our studio and put in the BP Harmony community. One thing, if you are guessing whether or not something like breath work can be useful in an emergency situation, Earlier this year, I did a corporate yoga session for a company, and I taught box breathing and the double inhale method, and then some mindfulness techniques on paying attention to the mundane details around us, kind of like what we did earlier. And several months later, one of the employees reached out to me and said, my wife, she went into labor 3 months early, and she was dealing with a lot of suicidal ideation before, during the delivery, and postpartum as well. And he said, just that one breath work session that I learned from you during the delivery, especially we did box breathing. We noticed the mundane details around us, and that helped my wife um, relax, and she was able to deliver the baby. And that was a huge moment for me where I felt very honored that I'm taking part now in this process of democratizing this knowledge. And it's not something that I bring a unique perspective from my experience, but it is having pulled from various disciplines of expertise that I am now able to pay it forward. And that's why I felt compelled to start BP Harmony and to make certain offerings. It's because when I was going through the marshy waters of depression and the intensity of mania, it was the narratives of people who had the lived experience of bipolar disorder who were on the other side where I found hope. I found hope when I didn't believe it myself that I can get better, that recovery is possible, and that it's not just going to be mere symptom regulation, but it's going to be healing and recovery. And of course, there's things that I can't say legally. I can't say that there is a cure to bipolar disorder, but certainly there are ways to move towards a place towards recovery. I'm not cured of asthma, but I haven't had to take an inhaler for decades, and I haven't had an asthma attack. Yes, it's a fragility that I have to be aware of and vigilant and guarding against. But in the same way with mental illness, today I'm in a position where I'm not taking medication, but I do have days where I don't feel so well, and I turn to the five pillars. I turn to my community. And so before we turn it over to the audience for questions and answers, I do want to take a brief moment to talk about the offerings that we have at BP Harmony. Some resources that we offer, I wrote a book called The Five Pillars of Bipolar Recovery, where I outline in detail some of the things that we've talked about today, but I outline practical strategies on sleep, nutrition, movement, mindfulness, and community. Then I have certain courses that are recorded, Yoga for Bipolar Recovery, and my master course, The Five Pillars of Bipolar Recovery, where I teach the book and I add in a lot more commentary. Additionally, you can work with me one-on-one with 90-minute sessions, and then I've created other products that are more general, quick desk revitalize if you have a sedentary lifestyle, affirmations for better mental health. My point is I would like healthcare to be accessible and affordable. I found it puzzling that I spent hundreds of dollars per doctor visit and then thousands of dollars on supplements and then another several $100 on an exercise coach and then another set of thousands of dollars on supplements. Excuse me. The pain point that I had that I want to offer is to be affordable and accessible. And so all of these products, what I've done for the next evolution for BP Harmony is to build the Bipolar Harmony online community. And there's 3 tiers, but the first tier, excuse me, the foundation tier, you will have access to an online community of 24/7 peer-to-peer support where you can share your struggles and your triumphs. And you will have access to a mental health content library where content like this we will continue to build. And already there is nearly 100 hours of content. Excuse me. Then for the rejuvenation module, you have access to the content library, but also live classes that yours truly will be offering. And I'll also be bringing some of my colleagues who are experts in mindfulness and yoga. And finally, if you want to add on a quarterly nutrition plan where we take in your pre-existing health conditions, we take in your height, your sex, your weight, your goals, and we'll come up with a nutrition plan. Excuse me, something went into my throat. But not quite ready to make a paid commitment just yet? That is not a problem. Again, my hope with BP Harmony is to be the premier resource amongst the many resources that exist out there. To come to bpharmony.com, find benefit from the videos that are there of me doing yoga and mindfulness and talking in my blog about medication, about hydration, about all sorts of things. And then you can also join the free discussion forum. This is a free community forum for anyone looking for bipolar disorder support. Join and talk to peers 24/7 with similar circumstances as you or your loved ones. So I found tremendous healing just talking to people who get it, who know what I'm going through, and who are there to listen. And so we at BP Harmony are here to listen to your struggles. With that being said, we conclude our presentation. I'm going to stop sharing my screen and hit stop on the recording.